In a country that has long been praised for its fight against HIV, a new pattern is raising concern among public health experts. Divorced men and women are increasingly showing up in new infection statistics, with many cases linked to delayed testing and limited access to care.
We are seeing a very interesting trend in terms of, a high incidence of new HIV infections among the divorced or the separated individuals, and this is definitely worrying.
Men who recently divorced, unfortunately, or separated from their spouses or lost their spouse, they contribute the second highest number of new HIV infections. We see the third population group most affected by new HIV infection are women who recently divorced.
Among men, the challenge runs deeper. Health workers say self-stigma, the fear of judgment, shame, and appearing weak continues to prevent many from seeking HIV services.
There are around 600,000 men living with HIV. But of the 600,000 men living with HIV, 7% are scared of coming, or the services have not reached them. They are busy at their workplaces. Of the 93% who have come forward and tested for HIV, only 87% are brave enough, are courageous enough to come and line up and receive the free, effective HIV treatment. The other 13% have refused because of issues related with stigma.
For Uganda's working class, those balancing long hours, unstable jobs, and financial pressure, health often takes a backseat. Clinic hours may clash with work schedules, and for many, the fear of being seen at HIV facility only adds to the hesitation.
We are seeing a challenge around the middle class, the high class individuals who actually self-stigmatize. When you talk of stigma, it might be, yes, more of external, but there's also that self-stigma that comes from within the individual, especially the middle class, the high class. You are at a status of, really these high class individuals that,
Among divorced couples, experts say emotional distress, new sexual partnerships, and reduced communication about HIV status are contributing factors to the rise in infections for both men and women.
So many people think we are done with HIV because most of our people who are HIV positive are now on treatment. They look healthy, so the incentive, the fear has gone away.
Health advocates are now calling for more targeted approaches like workplace testing programs, flexible clinic hours, and community messaging that directly address self-stigma.
The bosses at the workplaces are not allowing our men, especially men in the workplaces, the free time, the privacy, and the free time to go and pick their refills. So that's why we see so many men are left behind. They are dying of AIDS-related illness. They are so busy to go out and look for the service they need, the prevention services. So they have been left behind.
Currently, Uganda's national HIV prevalence among adults aged 15 to 49 is approximately 5.1% to 5.4%. As of 2023, roughly 1.49 million people are living with HIV in the country. However, prevalence is higher in females, ranging between 6.5% to 7.2% compared to males, approximately 3.6% to 4.3%, and the infection rate is higher in urban areas. But